Hello, my name's Nigel Stephens and I'm a consultant cardiologist, and I'm here just to talk a little bit about sports cardiology. This is a new thing. Some 20 years ago, the Olympic Medical Institute was at my NHS hospital, and myself, together with a guy called Professor Greg White, set up a service for sports people where there was concern about heart disease. We saw more than 1,000 athletes over 10 years, and a lot of the things that have now become more widely known and understood about the relationship between sport and heart disease. Greg and I were the first people to see it, just because we were seeing a lot of sports people in the same clinic and seeing patterns that others hadn't spotted. If we scroll forward a little bit, I'm now working at the Institute for Sports, Exercise and Health in the centre of London, which is a great service, a joint venture between University College Hospital, University College London, the Olympic Medical Institute and the provider HCA. And here we have an integrated setup where we can have access to cardiac testing like cardiac ultrasound, ECG testing, and also an excellent physiologist who works with us, Nathan Riding, where we can do quite sophisticated cardiopulmonary exercise testing. Sports cardiology started off thinking about rare and uncommon things which can sometimes tragically cause sudden death in young athletic people. But the majority of what we now see is quite different to that, and it represents a generational change where people after the age of 40 still want to train, to exercise, and to do competitive sport or major challenge events. Cyclists may be familiar with the Étape du Tour, where amateur cyclists will ride the same route as the Tour de France that will have gone through a few days before or after. And because of the age and other factors, we quite often see people who have known or suspected heart disease who still want to continue with sport. And their emotional investment is often considerable. For them, it might be as important as their job or their marriage that they should carry on enjoying sport. I come at it from a perspective of still enjoying competitive sport myself. And what I often find is that colleagues have been referred on folk with these issues for a second or third opinion, and they've had excellent medical care, no issue with the diagnosis or advice they've been given, but it's been very much from the perspective of, well, you could always do a more sedentary thing and enjoy that. And the person would come and say, well, actually, I still want to race my bike. I still want to do time trials. I still want to do park runs. I still want to do masters rowing. What do you think? We've accrued a lot of experience, and together with expert body guidance, for the majority of folk, the majority of the time, we can endorse their continuing in sport or continuing with some small restrictions. For instance, somebody who enjoys lifting in the gym, you might say to them, you can continue to lift and you can continue to lift heavy, but I don't want you to do 1 rep maximums. I don't want you to do Olympic lifts or other explosive plyometric movements, but a lot of other things are entirely compatible and safe with what you do. This is a burgeoning, growing niche within our specialty and a pleasure to work in, not least because it's a small community who also do it, and we often share experience with things where we're learning as we go on, and some of the things are unique and are being talked about and described for the first time.